بسم الله الرحمن الرحيم، وعلى بركة الله نبدأ محاضرتنا لهذا اليوم المصادف الثلاثاء 1 شهر السادس 2021. صوتي واضح طلاب؟
اي واضح دكتور.
So today we are going to have some idea regarding the neuromuscular disease or neuromuscular disorder. As a general talking, why we are going to use this subject? We are going to use this subject because there are many types of patients who are complaining from a neuromuscular disorder and attending to our dental clinic. Second, the type of treatment that is going to be taken by these types of patients is going to be alter the oral health status directly and indirectly, as we are going to see. And most of those types of patients may need a dental treatment, and they have to take a specific precaution before we are going to deal with them. So let's start with the neuromuscular disease and let's have some idea about these diseases. First of all, what I mean exactly by the neuromuscular disease, neuromuscular disorder or disease from its name. So the effect is going to be occur on the neuron, and the other effect is going to occur on the muscular, as we are going to say. We know that the brain and the spinal cord, they have different types of nerve, which is going to be distributing in all the body. And as a general talking, the nerve, as we are going to see, is passing from the spinal cord to the muscles. So this junction is called the neuromuscular junction or the neuromuscular disease. So, as a general talking, when there was a defect in the nerve or when there was a effect in the muscles, this is exactly what we call it the neuromuscular disease. And here, any difficulty or any disturbance in the communication between the nervous system and between the nerve, the result is going to be occur by the neuromuscular disease. And as a result of that, most of the muscles which is going to recept the nerve from the spinal cord may complaining from weakness, complaining from rigidity, and even lose of the muscle control, even though tingling, numbness, and muscle spasm also. Even the most important philosophy is there is a disturbance in the connection between the nerve and between the muscles. And as a result of this, neuromuscular disease is going to be initiating and it's going to be occurring. We could classify the neuromuscular disease according to the following: CVA, cerebral vascular disease; MS, multiple sclerosis; Alzheimer's disease; Seizure disorder, epilepsy; Parkinson's; and وهن العضلات, the myasthenia gravis. نبدأ بالcerebral vascular disease. Cerebral vascular disease is that disorder that causes to the damage of the small blood vessels which is going to be supplied to the brain. And as a result of the decrease in the supply of the blood vessels which is supplied to the brain, the result, the cerebral circulation is going to be affected and neurological damage is going to be occurred. Sometimes this neurology or this, it could be complete, and they will be associated with impairment in the cerebral circulation, which may result in death and neurological defect, or sometimes complete liquidations of the flow may render an irreversible cerebral infraction. And this may occur within 3 to 4 minutes, either complete or either partial. Both of them may be associated with the neurological disorder. So what are the neurological events which are related to the CVA? Sometimes there will be transient ischemic attack. That is to say, it is considered to be as reversible and short duration. And that's what we call it reversible ischemic neurological defect. So this neurological defect that's not persisting for a long period of time and is going to be retained within normal. Sometimes it is going to be persisting for 24 hours or sometimes more than that. That we call it TIA, transient ischemic attack. As a general talking, the symptom of the CVA or cerebral vascular disease or clinical manifestation depending on which the area of the brain is going to be affected. أين تحدث في أي مكان. Sometimes it may be associated with a motor effect, sometimes the extra muscles, sometimes the eye movement or visual defect, even though it could be start as sudden headache, and further changes may be associated with dizziness, using scissors, and even the speech and the hearing is going to be affected also. Even if we could classify the general symptoms of the stroke, sometimes it may associate with the motor effect or with the sensory, and the most important and serious, it may associate with the visual or speech impairment. What are the causes or what are the main causes of the cerebral vascular disease? Most of the cases may occur due to the atherosclerosis. That is to say, there will be inadequate amount of blood which is supplied to the cerebral area, and the result is going to be associated with a cerebral ischemia and infraction. These atherosclerosis may be associated with the thromboemboli, and as a result, the occlusion of the cerebral blood vessels may occur, which may lead to the neural disturbance in the function. Sometimes hemorrhage may occur. That is to say, the same blood vessels. Sometimes less amount of blood vessels is going to be supplied to the area of the brain, or sometimes, which is less causes, more blood is going to be supplied. That is to say, it may be associated with a hemorrhagical event. And main cause of the cerebral hemorrhage, it could be trauma, could be hypertension, and sometimes neurosal ruptures also. تلخص بطريقتين، يا اما atherosclerosis يا اما cerebral hemorrhage. We could have an idea about the lacunar stroke. There will be obstruction of the small blood vessels, which is going to be penetrating the arterioles, mostly occur in a patient with hypertension, which is considered to be the main predisposing factor. And here there will be unilateral motor or sensory effect. Again, the visual field is going to be affected. Sometimes we are going to call it as a mini stroke. As I said before, TIA. And here the symptoms is mild and it is not considered to be as a permanent damage, and it is going to be returned to normal. While if the large vessels is going to be affected, not the small vessels, here it is going to be called the cerebral infraction. And this may occur due to the thromboemboli effect along the distribution of the internal carotid artery and even though the cerebral artery. You have to know that this emboli sometimes is going to be originating from the heart If the patient previously have been infected by MI condition, or sometimes by atrial fibrillation, or sometimes due to the hypertension, particularly this effect sometimes may occur in the carotid bifurcation, and in which the carotid artery is going to be external and internal carotid artery. And as a result, all the neurological function, the motor and sensory, is going to be affected. And this is what we call it the brainstream infraction. Sometimes this CVA may be associated with affectable level of the respiratory rate. That is to say, the effect may occur in the brain, in the area which is responsible about what? About the respiratory centers or respiratory system. Therefore, the level of the respiratory is going to be affected. So, the symptoms of the TIA, sometimes it is, or most of the time, it does not persisting for a long period of time, and even though sometimes a recovery is going to be occur within a few minutes, but we could demonstrate it in a patient with TIA that neurological signs or symptoms developed. And this neurological, whatever it was, a motor and sensory, as a general talking, is depend on which area of the brain is going to be affected. Sometimes in the frontal lobe, contralateral frontal lobe, or even sometimes the vertebral basal arterial system is involved, and here more complication could be demonstrating, like dizziness, diplopia, double vision, dysmorphia, and so on. The treatment, whenever the diagnosis has been established, correction of the immediate pathological problem, control the primary underlying problem, that is to say, if the patient complaining from hypertension, which is considered to be as the most common, and cause, or here we could be prescribing sometimes anticoagulant type like heparin, warfarin, even though aspirin, which is going to be reduce the frequency of the TIA. And here we could demonstrating the differential diagnosis of the CVA. Sometimes it is seizures and resemblable to the hypoglycemia, even though the intracranial lesions or tumor, encephalitis, and MS, and membranous area also. Diagnosis, first of all, through the neurology and careful examination of the cardiovascular system. As I said before, if there is any atrial fibrillation or any MI, which is going to be initiating the thromboemboli, here we could take the most important way to make a diagnosis is by magnetic resonance imaging, by MRI. And even though CT scan is very important to diagnose that. There are another laboratory investigation which is needed for the diagnosis in addition to the CT and MRI. And this may include the complete blood picture, the differential cell count, the urinalysis, the coagulation profile, and the blood culture is important, and even though sometimes we need to make a lumbar puncture. Even the TIA and the treatment as a general, we have to know what is the cause. If the cause is related to the hypertension, so antihypertensive drug is indicated. Further instruction should be prescribing for the patient, whether the diet, the exercise, and taking the anticoagulant and antiplatelet medication. While the management of the acute stroke attack is actually not like that I have mentioned before. Here, a medical therapy should be used, and here, the patient he have to control the hemorrhages of the patient, and even though revascularization is indicated, and whether and whenever the intracranial hemorrhage is going to be occur, which is considered to be as a source of acute cerebral ischemia, thrombolysis with intravenous tissue plasmon gene activator is very important in prescribing for the patient to minimize the effect of the infection. Sometimes the patient attending to us and he's complaining previously from stroke. We have to know what are these manifestations which may associated with a transient ischemic attack or with a CVA. Here the patient, all the facial muscles sometimes is going to be involved, and even the masticulatory muscles. This sensation, dysphagia and difficulty in swallowing, the gag reflex is going to be affected. Therefore, patient may attending to us with a poor nutrition, and he's complaining from loss of weight, even dysphagia, choking and gagging is going to be occurring, difficulty in swallowing also. And one of the most important complications which may be associated with those types of patients, and this complication is related to the motor function of the masticulatory muscles and the facial muscles. So, as a result of that, the patient may have a reduce in the fluid clearness from his mouth and teeth. And as a result, the oral hygiene is going to be infected, and it is highly risk to develop the caries and the periodontal diseases. So what is the responsibility of the dentist in dealing with a patient with a CVA? How is going to deal? Please try to avoid any invasive dental treatment for those types of patients unless you made a good consultation with his physician, because he's taking some medication, as I said before, the anticoagulant, the heparin, the warfarin. So these types of patient may have adverse effect on the oral cavity, and this patient need to be investigating for bleeding time, prothrombin time, activated partial thromboplastin time, and so on, because this anticoagulant medication is going to be effective that. إذن هؤلاء البيشنت, those types of patient who is taking these types of medication, here warfarin, heparin, most of those types of patients complaining from previously of stroke. So please try to make fully investigation before you are going to manage them. Another important taken into consideration, as I said before, prothrombin time, bleeding time, activated partial thromboplastin time, and the types of medication may lead to the decrease in the salivary secretion, and those patients may complain from xerostomia. Again, the orofacial area is going to be affected. How it is going to be affected? كيف تتأثر المصل of the face? Usually there was a weakness in the muscles of the face, and as a result there was a difficulty in mastication and difficulty dysphagia, difficulty in swallowing, and most of them they are attending to us with a poor nutrition status, even though the voluntary types of muscles of the tongue is going to be affected also. Even history taking, blood pressure monitoring, try to make a short appointment to those types of patients. In addition, try to make these laboratory investigation. أخذنا هذه المحاضرات الأولى واللي تعتبر كلش مهمة بالنسبة لنا. Another complication is called the cavernous sinus thrombosis. Thrombosis of the cavernous sinus as a result of infection and sometimes the tooth, and especially the upper part tooth, is considered to be as a response. And even though the infection of the paranasal sinus or central sinus, whatever, the ethmoidal sinus, nasal sinus, frontal sinus, all of them considered to be as a source of infection. The upper maxillary teeth, as we know. So what's going to be again the separate of the infection from this area to the cavernous sinus, and as a result, those types of patients may complain from different sinus symptoms, as I'm demonstrating, even though it may starting with the swelling and redness, and in a rare cases, scissors is going to be a key, in addition to fatigue and the diplopia or the devolution and other complications that I have mentioned. Again, cavernous sinus thrombosis, the patient may complaining from numbness in the muscles of mastication, even though we could demonstrating that the eye is going to be involved, and here the patient is complaining from exophthalmos, retinal thrombosis, vein, and pyramidolar edema. So as a general topic, with the ophthalmic nerve, or which is considered to be as a branch of the trigeminal, مثل ما نعرف التراجمنال ينقسم إلى ophthalmic وإلى maxilla وإلى mandible. Those types of patients may complain from ptosis, dilated pupil, and the coronal reflex is going to be affected. Who's those types of patients who are suspectable for cavernous sinus thrombosis? Uncontrolled diabetic recurrent infection of the oral cavity, considered to be as the cause also. Treatment: here a heavy dose of antibiotics should be represented to the patient, IV metronidazole, if we suspect that the infection from the dental or from the sinus. And even though, that is to say, we have to make antibiotic sensitivity test, and antibiotic should be representing or should be administered to the patient for extended period, even after the infection has been subsided, in order to make sure that the complete sterilization and there will be no relapse of cavernous sinus thrombosis. So we're going to deal with the cavernous sinus thrombosis. Heavy dose of antibiotics should be prescribed according to the antibiotic sensitivity test. And please do not stop the medication, even the subside of the symptoms is going to be appeared, because sometimes relapse may occur. إذا من تعطي العلاج أرجو أنه تستمر وياه لفترة حتى ورا ما ينتهي الساين والسيمتومز مالتي to prevent relapse. Another neuromuscular disorder is the multiple sclerosis. MS, تصلب الأعصاب المنتشر. Multiple area of the central nerve system is going to be affected. And here, the nerve may occur, the nerve sheath may complain from demyelinating, or sometimes even scarring. يعني احنا لما نعرف انه النيرفز والمyelinated sheath مالته يكون داير مداير. Sometimes there will be scars, what we call it gloises, or scarrings at the nerve sheath, or even though demyelinating, that is to say there is no myelinating sheath surrounding the area, and as a result completely block off the impulses is going to be occur. The patient may complain from any neurological sign of symptoms. الآن multiple sclerosis ونسيت أكثر شيء شباب طبعا أعمار 20 to 25, or even though 30 or 40 years old, يعني منتشر. A lot of patients attended to us, they are complaining from multiple sclerosis. وجدت انه من المناسب انه نتكلم عن هذا الموضوع. طبعا الاكزاكت etiology مالته nobody knows till now, but there was a many factors which is going to be influenced. Some considered to be as an autoimmune diseases, even though some considered to be as a virus, whatever these types of virus, which is going to be affecting measles and mumps. Nobody knows till now exactly. Human herpes, and sometimes they have been detected the herpes simplex virus type 1 or type 2, even though they could detect the virus in the cerebral spinal fluid, or sometimes they detected the antibody against these types of virus. على pathophysiology مالته يعني which is going to be affecting the central nervous system and associated with the neural degeneration and even the tissue damage. Here the impulses between the nerve ending is going to be affected. يعني ليس هناك انتقال للإعازات العصبية التي تحدث بين نهايات الأعصاب. المبدأ الرئيسي انتقال الإعازة العصبي عن طريق النيرف إلى العضلات، وبالتالي هناك كيميكال ميدياترز موجودة في نهايتها تقوم بالcontractions or relaxations contractions of the muscles، وبالتالي المسلز is going to be removed. في مثل هكذا حالة هناك خلل في انتقال الإعازات العصبية through the neuromuscular junction, and as a result of that those types of patients may complain from neuromuscular disease. ماذا يحدث عند هؤلاء البيشنت؟ What are the clinical symptoms? The clinical symptoms يعتمد which area is going to be affected. Sometimes the optic chiasma is going to be affected, so the patient may complain from visual disturbance. Sometimes the cerebellum is going to be affected. But the most serious condition, sometimes those types of patients may complaining from ophthalmic symptoms, even blindness, diplopia, and sometimes Pofessor signs, which is mostly occur in the multiple sclerosis, and here the patient is just a limited of time is complaining from loose or rapid loss of vision. Sometimes electrical shock sensation is going to be occur, and it is going to be transferred to the legs, and which is considered to be Leber-Meritis syndrome, Leber-Meritis symptoms, which is considered to be as very important, but it is mostly self-limiting. And even though it is going to be persisting for years, so as a general talking patient complaining from weakness, paresthesia, even though the urinary tract infection may occur due to the bladder dysfunction, that is to say, there will be يعني, the patient the the bladder is going to be filled with the urea for a long period of time, which is suspectable to be infected. And most of these complications is characterized by clear up and remission. Sometimes it is going to be extended for years, even though neurological system sometimes it is considered to be as a permanent. Diagnosis مالته يعتمد على neurological signs, history, remission and the flare up. Actually, ماكو أي laboratory investigation to confirm that, but they use an MRI. Sometimes they could demonstrating that there is abnormality in 90% of those types of patients. Even though we could take the cerebral spinal fluid for analysis, and sometimes increase in the total serum protein and the mononuclear white BC also. إذن يعتمد بالدرجة الأولى المالتيبل سكليروسيس التشخيص مالته بالكلينيكال سيمبتومز، تؤخذ الام ار اي، أيضا we could demonstrating plaques sometimes in MRI surrounding the nerve أيضا يؤخذ من النخاع عن طريق السيربرال سباينال فلويد أيضا. عادة البيشنت المشكلة مالته يعني it's not going to be يعني completely cure لأنه هؤلاء المرضى those types of patients they are taking immunosuppressive types of medication. So the complication of those types of patients is either related to the multiple sclerosis itself or it may related to the type of a treatment. كل التريتمنت هو الستيرويد ومثل ما نعرف وتكلمنا عن الستيرويد في سيميناراتنا وفي محاضراتنا هو سلاح ذو حدين وله الكثير من الكومبليكيشن. هذه الكومبليكيشن قد تؤثر على البلاد بريشر، قد تؤثر على السكين وقد تؤثر على level of the diabetic of the patient. Anyhow, it is going to be affected on the GIT system. It's going to be affected on many organs. ولهذا those types of patients who are taking prednisolone or corticosteroid, even another immunosuppressive type of medication, isoflurane, which is considered to be as immunosuppressive or methotrexate, كل هذه الأدوية it is not going to be what we say will have a completely remission of the multiple sclerosis, but flare up and remission, flare up and remission. And due to taking this immunosuppressive types of medication, complication is going to be initiated. لهذا المشاكل اللي عندي عند هؤلاء المرضى نتيجة المالتيبل سكليروسيس أو نتيجة الأدوية اللي هي تعتبر الاميونوسuppressive type of medication. Power. Look here exactly what's going to be representing for those types of patients. Trigeminal neuralgia may occur, and we have adequate amount of information regarding the trigeminal neuralgia. Patient may have a neuropathy, either peripheral neuropathy, mononeuropathy, that is to say one type of nerve, whatever, the mandible, the maxilla, or more than one nerve. Neuropathy sometimes is going to be occur on the mental nerve. Myokemia could be demonstrating for those types of patients, and during a clinical examination we could see that there will be rapid contraction of the facial muscles. إذا كانت هناك lesions أو هناك demyelinating occur on the facial nerve, here we could demonstrating that there will be rapid contraction of the muscles of the face, and sometimes we could demonstrating that there will be facial weakness. Even though the patient may complain from dyscalculia, difficulty in speech, and even though temporomandible joint that I have mentioned before may affected by the multiple sclerosis. Look, whatever the nerve is going to be affected, the area which is going to be supplied by the nerve is going to be affected. If the facial nerve is going to be affected, so the facial muscles is going to be affected. If the optic nerve is going to be affected, so patient may complain from double vision, loss of vision, diplopia, whatever. So depends on which nerve is going to be affected in MS. طبعا when we are going to deal with these types of patients, please take it into consideration that these types of patients taking immunosuppressive type of medication. كن حذر ابني لما تتعامل ويا مرضى جماعة المالتيبل سكليروسيس، الكثير من عندهم يجون. If you are not fully informative about this condition, please try to send for others who are specialists. Because these types of patient taking immunosuppressive, give him instruction also. Because these types of patient may have a poor oral hygiene because he is difficulty to brushing or taking a strict oral hygiene and difficulty in swallowing, which led to acclimating of the fluid inside the mouth of the patient. مرض آخر الآن منتشر وموجود بكمية اللي هو الزهايمر AD, which is characterized by diminution and there will be deterioration in the cognitive ability, قابلية الإدراك of those types of patient is going to be affected. And the most important thing is the memory of those types of patients. Even though they do not have the ability or lose their specific skills and the judgments, even though the language of those types of patients is going to be affected. The exact etiology, they thought that the genetic factors play a great role. And they have been demonstrating many familiar Alzheimer's disease, which is considered to be an autosomal dominant, not autosomal recessive. And that's need only one gene from the parents in order to be a parent. So Alzheimer, it is considered to be a slowly progressive disorder. Either we classify that into preclinical, or sometimes that is to say preclinical, or sometimes there will be mild cognitive impairments, and as a result of that, it changes.
العفو دكتور، بس صوت حضرتك ابد مو واضح.
بابا
صوت حضرتك يعني كلش بعيد دكتور.
And here there will be mild changes in the memory, and even though the cognitive ability. هسه أوضح بابا؟
اي نعم دكتور.
And those types of patients may complaining from dementia. And here, as we know, the cognition and the behavior of the patient is going to be affected. The initial sign of Alzheimer, there will be retrograde amnesia from progressive decline in the episodic memory. Then after that, unrecognized could be demonstrating, and patient may complaining from memory loss. And all the daily activity is going to be affected. This is the way that we could make a diagnosis of the preclinical Alzheimer disease. We could demonstrating the biomarker assessment, even though they are taking the cerebrospinal fluid. And after taking MRI, we could demonstrating that there will be brain atrophy. And as a result of that, the Alzheimer disease may complain from dementia, even though any neurological status may associate it with that. Again, the patient may complain from hypothyroidism, CVA, or vitamin deficiency, and some of the complications may relate to the type of medication. 2 protein is going to be demonstrating on the cerebrospinal fluid, and the lower concentration of AB peptide in a healthy patient. Another method of examination is here electroencephalographic hair studies, and here we could demonstrating EEG, generalized slowing without focal features. Another way for the examination is the CT and the MRI. We could demonstrating that there will be a brain atrophy also. الحقيقة أغلب النيوروماسكولار ديزيز اللي ذكرناها، السيربروفاسكولار، المالتيبل سكليروسيس، الزهايمر، حتى الإبيليبسي اللي راح نحكي عنه، الباركنسونز، المايزاثينيا جريفس، ماكو كيور 100%. characterized by remission and flare up. كل الأدوية اللي موجودة بالنيوروماسكولار ديزيز it is just to prevent the deterioration of the disease, just slowing the progressive of the disease. مثل ما راح نشوف ميمانتاين، هذا type of medication يستخدم، هذا the most common types of medication. and the another types of medication اللي موجودة عندنا. And here we could demonstrating المطلوب من عندك طبيب الأسنان إنه تعرف الميمانتاين إنه هذا types of medication يعطى لجماعة الألزهايمر. هذا لما يجيب لك المريض هذا الدواء you have to know that this patient is complaining from a neuromuscular disease. Sometimes this type of medication is going to be used in the conjunction with the cholinesterase inhibitors. Even though antidepressant could be prescribing, and sometimes alpha tropicofol, vitamin E, cholesterol lowering drugs, and anti-inflammatory and herbal sometimes it could be demonstrating for Alzheimer's. Consideration when you are going to deal with these types of patients. First of all, the oral hygiene. Those types of patients need a strict oral hygiene. يجب أن تحط على good oral hygiene because they are complaining from coronal and root caries, and mostly they are associated with a periodontal disease and infection. Look, again, the temporomandible joint is going to be involved. And we have to give him instruction, and we have to make a regular dental examination for them. Even though try to prevent any complex dental treatment for them. In consideration when we are going to deal with these types of patients تنقسم إلى نصفين. Instruction and taking into consideration the type of medication for this type of patient. في بعض الأحيان البيشنت ياخذ cholinesterase inhibitor، هذا ممكن يسوي excessive salivation. في بعض الأحيان البيشنت ياخذ الانتي ديبريسنت يسوي zero stomach. Even though sometimes stomatitis may occur. And anticholinesterase may increase the possibility of the gastrointestinal irritation. And here you have to take into consideration that those types of patients taking this medication may be highly susceptible for bleeding, specifically if he's taking non-steroidal anti-inflammatory. Therefore, all the investigation that I have mentioned before regarding PTU activated partial is going to be investigating before apply any types of treatment. Look, regarding the local anesthesia، طبعا اكو هناك دراسات عديده فيما يخص علاقه اللوكال anesthesia with the neuromuscular. قسم يقول لك without adrenaline، قسم يقول لك it's going to be affected with a tricyclic antidepressant، قسم يقول لك الاندوجينous secretion مال الادرينالين from the body when the patient is going to be exposed to pain is more than the adrenaline which is going to be represented into the pool. يعني different controversial idea regarding that, because sometimes it may associate with a hypertensive or dysentery. Another types is Parkinson's disease. Parkinson's disease, it could be diagnosis clinically. Here the patient is complaining from mask face مثل ما حكينا عليها بالمحاضرات الأولى facial characteristic features, and he is complaining from tremor, rigidity, bradykinase, and impaired posture reflex. In Parkinson's disease, it could be affected any area: eye, the mouth, the skin, the muscles, and so on. And sometimes, even though it may, when you are taking history from the patient, you will see the patient he has previously exposed to any source of trauma, like for example post-traumatic Parkinson's, when the patient has been exposed to the head injury. أهم نقطة هي الماسكولار face. Lack of this expression. Could not demonstrating any expression of sadness or happiness of the muscles of the face. Even though the patient attending to you and we have saliva, difficulty in swallowing, and even though the mandible tremor, and those types of patients may have investigatory in difficulty. And these are the most other abnormalities in the oral behavior. Chewing, grinding, psychic movement is going to be affected also. Another disease of the neuromuscular هو facial palsy أو Bell's palsy. كلش common and very important to know the etiological factors and the management. خلينا نتكلم على etiological factors مالته بصورة عامة, which is going to be affected the masseter's muscles, affected of one of the side. Sometimes it may be associated with a herpes simplex virus. يعني فيروس بصورة عامة سواء كان herpes simplex, herpes zoster, Epstein-Barr virus, cytomegalovirus, and the another types of virus. And if you are going to take a history, we will be demonstrating that the patient have a previously viral infection near the area in which the virus is going to be persisting when the immunity of the patient is going to be acquired. It's going to be depressed, the facial paralysis is going to be acquired. And the patient may attend complaining from the following: weakness of the muscles of the face, swelling, facial dropping, and sometimes when we are going to take a history, we could demonstrating the test of the patient is going to be affected, even though changed in the amount of tears. ماكو هناك specific test يعني ممكن نسويه in order to demonstrating, but another condition such as stroke or infection, Lyme disease, tumor, all of these may cause facial weakness or facial paralyzed. We are going to send the patient for the EMG in order to confirm the presence of any damage of the nerve. بصورة عامة لما نتعامل ويا هؤلاء المرضى, يعني أرجو طبعا يعني please do not deal with the facial palsy unless you are adequate information. Why? لأنه facial palsy ممكن أن يكون مجرد viral infection where a simple type of treatment is going to be resolved with a muscle exercise, but sometimes there will be persisting damage of the facial nerve, يعني facial nerve persisting for a long period of time. We need another investigation, starting from evaluation of the salivary gland in which the facial nerve is going to be affected till the brain, and this could be occurred by the CT and MRI. ولهذا قد تكون هو serious condition. كثير من البيشنت attending to us, they are complaining from facial palsy, and we have to fully investigate it. Myasthenia gravis وهن العضلات, which is characterized by progressive يعني يستمر بالdeterioration in the deteriorating of the muscle weakness. It is considered to be as an autoimmune disease, which is going to be affected the neuromuscular junction. إذن all of these type of disease هناك nerve يأتي إلى المسلز يعطي instructions, سواء كان هذا الانستراكشن يعطي بالcontraction or relaxation. So when there is any defect in the neuromuscular, هذا هو nerve recover وهذا هو muscles, هنا النيوروماسكولار جانكشن، النيوروماسكولار سيجمنت، هنا الكيميكال ميديترز اللي تطلع نتيجة الانستراكشن اللي تأتي عن طريق البرين أو عن طريق السباينال كورد. So what's going to be a care? The myasthenia gravis, the multiple sclerosis, the Alzheimer's disease is going to be a care. These are the most common symptoms. Ptosis, diplopia, تلاحظها أغلبها تكون متشابهة with each other. Exhibition of the face is going to be affected. Sometimes the patient may complain from tongue edema, and the patient may complain from repeatedly chewing, masticating, and even swallowing. Another neuromuscular disease, which is considered to be as a seizures, الصرع or epilepsy. المبدأ الرئيسي هناك نيورونز تكون موجودة في كل أنحاء البرين. هناك electrical activities between the neurons inside the brain. So what's going to be a care? There will be discharge from this type of a neuron, which is located in the central nervous system. Whenever there is a disturbance in the electrical activities between this type of the neurons, the seizures or the epilepsy is going to be a care. Sometimes there will be focal seizures category, partial seizures. Within the network, and this a care network limited to one hemisphere. Clinical manifestation depend on which area or which site of the brain is going to be affected. Sometimes the frontal, sometimes the cortical, even the motor. So which nerve is going to be a care in the area of the brain which is going to be affected? The sign of the symptoms is going to be initiated. And sometimes it may be associated with the reparative movement. إذا يعتمد أي منطقة بالبرين اللي هي تنصاب. إذا كانت هذه المنطقة مسؤولة عن الأولفاكتوري، إذا كانت هذه المنطقة مسؤولة عن التيست، إذا كانت هذه المسؤولة عن الهيرينج، إذا عن الأوديتوري, the complication is going to be initiating. And here we could demonstrating that there is a generalized seizures, which is usually representing from the cerebral hemisphere, and abnormal neural activity is going to be a care, and even though the absence of this petit mel هذا مهم جدا أرجو أن تنتبه عليه. هو generalized seizures characterized by sudden brief lapses of conscious. يعني patient suddenly he is going to lose his conscious, but without loss of body tone. And sometimes it may occur during the sleeping, and here it is usually affected the circuit collecting between the thalamus and between the cortex. Other petit smell is very important. This type of seizures, not you will always like to think it is not associated with the loss of the body tone. Tonic clonic, grand mal, هذا أحد الأنواع. Other types of generalized seizures with a typical absence of tonic and myoclonic seizures. طبعا الايتيولوجي مالتها اذا يختلف باختلاف العمر. بالايرلي child sometimes it may occur due to the febrile seizures, and sometimes may occur during birth يعني اثناء الولاده. sometimes it may occur بالعمر 3 شهور الى 5 سنين. And even though when the patient يعني الرجل الكبير, sometimes it's going to be reflect a serious condition. يعني any intracranial lesions may associate it with the seizures or epilepsy attack. If the patient has severe alcoholism, if the patient is a drug taking, or even though hypotension for a long period of time may lead to that. أحد الكومبليكيشن مثل ما قلنا الكوزز يعتمد على الايج مال البيشنت. يعني من الايج اوف ذا patient is between شهرين او ثلاثه وينشمل او الى حد الثلاث سنين او اربعه، يعني يكون عندك طفل اذا اكو هناك complication at birth may occur when there is intracranial damage. There will be inadequate amount of oxygen which is supplied to the brain tissue, even though traumatic brain injury may cause that. لما يكون the patient older than that, older than that, sometimes this may associate it with a brain tumor. So the causes of the epilepsy is depend on the age of the patient. Brain tumor is mostly occur in a patient after the second and the third decade of life, and this may associate it for seizure, associated with a seizure attack or epilepsy attack. If the patient is younger, that is to say between 3 to 4 months, there will be previously complication during birth, which may lead to the head injury and inadequate amount of oxygen supply to the brain tissue. Other international classification of the epileptic seizure: simple partial seizures, complete, complex partial seizures. هنا generalized والبيتيبل اللي تكلمنا عليها. Sometimes it may associate with tonic-clonic seizures and atonic seizures, static seizures. Generalized tonic-clonic الجراند ميل most common type، يعني أكثر نوع هو الجراند ميل نسميه احنا. And the absence pitymal seizures also. هذا هي two types of the generalized seizures. عادة كيف يبدأ هذه نوبات الصرع بالنسبة للمريض؟ Sometimes it is going to be starting with aurea. So what I mean exactly by aurea, يجيك المريض يقول لك دكتور ده اسمع اصوات مو طبيعيه او ده اشم روائح مو طبيعيه. And this is exactly what is called the hallucination of hearing or hallucination of visual effect or smell. Then after a second or 2 minutes, the patient is going to become unconscious. ومن تبدأ التقلصات التونيك spasm within 30 seconds. طبعا the most serious condition whether the muscles of the respiration is going to be affected, and here the patient could not be taking inspirating and respirating due to the paralysis of the respiratory muscles. وهنا the patient may complain of cyanosis, especially the cyanosis occur of the lip. Then after the tonic-clonic phase, there will be rapid jerky movement, and the patient is starting to bite his tongue, which is considered to be as a serious. Please try to take care when you are going to deal with a patient with epilepsy, because when the patient is going to be bite on your finger, sometimes excessive trauma may occur to you. Diagnosis: neurological examination with history. Even though we could demonstrating sometimes there will be electrolyte imbalance, magnesium, calcium, or sometimes it may occur due to specific types of medication. Again, CT scan and MRI are recommended. لاحظ الdiagnosis مال all the neuromuscular disease is mostly the same, starting from the history, from the cranial nerve examination, and we need the CT and MRI even though the EEG is indicated to compare that. الانتي-epileptic drug اللي تعرفوها الكاربامازيبام الدوز مالته 200 ويوصل إلى أقوال جيدة بالتدريج. But if the patient is taking these types of medication, try to make a liver function test from time to time, because sometimes we suspected leukopenia, and even though all the blood element is going to be affected, like in a patient with a plastic anemia, even though the patient may complain of folic acid deficiency. Phenytoin also, valproic acid, and gabapentin is important also. Sometimes after taking a CT or MRI, we could demonstrating that there will A lesion is going to be representing or intracranial lesion, therefore we send the patient for a surgery or brain surgery, and even though vagus nerve stimulation, placement of auriculite in the left vagal nerve, طبعا هذا new modalities of treatment اللي هي need highly technical procedures. So when we are going to deal with a patient with epilepsy, please try to take care whether he's stopping his medication or continue using his medication, and whether the patient is going to make a completely medical control of seizures, single seizure types, and normal neurological examination. And the patient may have a normal EEG also. And make sure that the patient is under the control of the physician of a neurologist in order to take the type of treatment. Other than, again, this type of medication, again, this type of disease, and that I say most of these types of disease, they are not cured completely, but you have sometimes it's going to be persisting for the wildlife, and some of those types of patients are resistant to this medication, and they may complain from deep brain stimulation, and the neurotransmitter system are jointly used for treatment of refractory epilepsy. Another new types of treatment is the gene therapy, and new modalities and treatment. What we are considered for those types of patients? Refer to the hospital, refer to his neurologist, taking whole history when the last epileptic attack has been occurred, and if the patient do not have implanted vagus nerve, do not require to give antibiotic prophylaxis, and try to be very careful when we are going to deal with those types of patients to prevent the epileptic attack during dental treatment. Again, these types of medication should be avoided in the patient taking valproic, and sometimes the patient may complain from gingival overgrowth due to the type of medication, even though some type of patient may complain of xerostomia or decrease in the salivary secretion due to the medication, and as a result of dryness or decreased saliva, candidiasis may occur and oral thrush, even though we could demonstrate the topical fluoride for those patients also. The anticholinergics drugs such as myostagamine and pyrazidine bromide, even though the amectomy and long-term corticosteroid and immuno are necessary. The anticholinergic anticholinesterase drugs النيوستاكامين هذا كلش مهم ويجون الكثير من البيشنت they are taking the newstagamine to our dental clinic. Sometimes they need a thymectomy also, which is considered to be as a surgical procedure, and patient may taking immunosuppressive also. هذا أغلب الميديكيشن اللي تستخدم بالتريتمنت of the epilepsy.